Hello everyone. Today we will talk about anxiety disorders. All people in the world have anxious thoughts and disturbing physical sensations. But non-anxious people are not afraid of their anxiety and perceive it without judgment. Anxious people, on the contrary, are very afraid of their anxiety and think that there is something seriously wrong with them and that their anxiety will make them go crazy or something. In order to become a non-anxious person, you need to get rid of fear of your anxiety. Look, we have several main areas of functioning in our everyday living: thoughts, emotions, physical sensations, and our actions, behavior. If your anxiety is concentrated on your thoughts, it will manifest itself as generalized anxiety disorder or OCD, obsessive-compulsive disorder, in which you are afraid of your thoughts. You think that they are harmful, and you will try to suppress and avoid them, and will try to defend yourself against them. In panic attacks and hypochondriasis, your anxiety is localized in physical sensations, and you are afraid of your normal bodily sensations. In agoraphobia and social phobia, you have fear of acting, fear of doing things freely, fear of being critically evaluated by other people in social anxiety. In PTSD, post-traumatic stress disorder, people avoid their feelings about the traumatic event. In PTSD, a person has a depression and anxiety at the same time. This is a characteristic feature of this disorder. But the trick is, anxiety is like a dragon with many heads, like a hydra. One head is OCD, another head is GAD, generalized anxiety disorder. This one is social phobias, this one is agoraphobia, panic attacks. If you will remove one head, it will regrow, or it will manifest itself as another anxiety disorder. So, in order to get rid of your anxiety completely, you need to kill the body of this monster by looking it right in the eyes without fear, by eradicating fear of your anxiety, and by get rid of avoidance, because avoidance is what really maintaining your anxiety. For all anxiety disorder, relaxation training, problem-solving techniques, and basic CBT can be helpful. Antidepressants as a long-term treatment and benzodiazepines short-term are also effective. Generalized anxiety disorder is characterized by excessive, uncontrolled, and irrational worry about everyday things like health, money, work, relationships, and natural disasters. The person finds the worry difficult to control and is restless, sweaty, shaky, and tearful. The main question you ask yourself all the time is what if question. What if I will never get a job? When you finally got a job, you think, what if I will have conflict with my boss? Or what if I will be incompetent? Or you may think, what if I will never get married? When you finally got married, you think, what if my partner will leave me? So you always find something to worry about. GAD is twice as common in women than in men. The average age of onset is 21 years. In order to help yourself, write down your worrying thoughts, consider whether anything can be done to resolve your worrying problem. If possible, take the appropriate action. If no action is possible, set aside a brief worry time each day. And for the rest of the day, use distraction to prevent worrying. There is a full comprehensive video about GAD on this channel. Do you wash and clean a lot? Do you check things a lot? Are there any thoughts that keep bothering you, that you would like to get rid of, but can't? Are you concerned about putting things in a special order? Or are you very upset by mess? If yes, you must probably have an OCD, obsessive-compulsive disorder, a condition characterized by obsessions and compulsions that the person feels driven to perform in order to prevent some feared event. Obsessions are unpleasant, intrusive thoughts about harming someone, or doubts about whether you turn off the light, water, gas, or fears of contracting some serious disease, like HIV. Compulsion is an act that a person performs in response to an obsession, such as counting repeatedly in a special way or excessive hand washing or lock checking. These compulsive rituals are followed by temporary release of distress. Men and women are affected about equally. Exposure with response prevention is treatment of choice. Exposure with response prevention. Touch the front door handle and don't wash your hands. Try to tolerate, endure this anxiety, and it will fall dramatically after 15 minutes. Left the house, don't return back to check whether you switched off the gas. Go to work, and then, in the evening, when you come home, you will see there is no fire. Write it down that you overestimated the probability of threat. Agoraphobia is an anxiety about being in places or situations from which escape might be difficult or embarrassing, or in which help may not be available. Agoraphobic patients are anxious when they are away from home, in crowds, in big supermarkets, cinemas, open spaces like parking lots, or traveling in a bus, usually due to fear of fainting or loss of control. This anxiety leads to avoidance of these situations. In severe cases, a person may become completely housebound. Agoraphobia may be with or without panic disorder. The median age of onset for agoraphobia is 20 years. Approximately twice as many women as men are affected. Agoraphobia is maintained by avoidance. The use of SSRIs should be combined with graded exposure to feared situations. Panic disorder is a condition in which a person experiences recurrent panic attacks that occur unexpectedly. Anxiety increases over a few minutes to a severe level, during which the patient fears some kind of catastrophic outcome, such as heart attack. Patients often become scared of having more attacks and of being in situations where an attack previously occurred. This can lead to agoraphobia. Panic disorder is at least twice as frequent among women as among men, and approximately 15 to 20% of the population experience at least one in their lifetime. In panic attack, you have fear of physical symptoms of anxiety, which are harmless. In hypochondriasis, you have fear of normal physiological processes in your body. In both cases, do not catastrophize and try to find an alternative, benign explanations for your symptoms. Social phobia is inappropriate anxiety in social situations about being negatively evaluated by other people, which leads to desire for escape or avoidance. Situations that provoke anxiety include restaurants, dinner parties, seminars, board meetings, and other places where it is necessary to speak in public, as well as fear of writing, drinking, or eating in front of another person. Blushing and trembling are frequent symptoms, and a person is concerned about that symptoms will be noticed by other people and will prove that the person is inadequate. Social phobia is about equally common in men and women. While taking any antidepressant medications, you should practice exposure to feared situations that you have previously avoided. The treatment of choice for simple phobia is graded exposure therapy, aiming to gradually reintroduce the patient to the phobic object or situation in a supportive manner. First, you talk about objects, then look at pictures and videos of them. Finally, you touch them if it's a thing, or endure if it's a feared situation.